Child, who is a general physician at Auckland District Health Board and also is the Chief Medical Officer at Southern Cross Health Society. Such a mouthful.
Well done. Thanks, Sam.
Yeah, so you've been at the conference here with the GPs talking about the future of healthcare. So tell us what you've been enlightening people on.
Well, I guess what I've been talking a little bit about is technology and about healthcare, and essentially what I say is starting about 100 years ago when people had ailments, which they have the same ailments they've had for 4,000 years, they would go to see a healer and they would pay money for that transaction. There would be some transactional between the patient and the healer. And then starting probably in about the 1940s when we started to get subsidized healthcare, there is now a funder in that relationship, and it's a three-way relationship between the healer, the patient, and maybe someone else who's partly or all paying the bill. And what's happened over the last 60 or 70 years is patient expectations have gradually been increasing. The funder is increasingly wanting value. And as the healer, our autonomy is decreasing such that our well-being is decreasing as a profession as well.
Yeah, okay. And so where do you see this moving as time goes on?
Well, I think each one of those things is only going to expand, and I guess my concern and my message to the profession is if we take each one of those, from the patient's point of view, their expectations are increasing, but their expectations are increasing in that health is a commodity. They want to be sit in their own living room with their ailment and be cured when they want to be cured, at the price they want to be cured, by the person that they want to be cured. And the concept of evidence-based medicine and going to the doctor for a trustworthy evidence-based healing, they don't trust that as much. And so evidence-based doesn't mean as much to them. And in other words, they're happy to get into an Uber, even they know that Uber isn't quite as safe as the commercial taxis. But they're still happy to be an Uber.
Yeah, okay. And so when you mentioned that as far as the health of the clinicians or the practitioners, what do you think that we should be doing as clinicians to help ourselves and move forward in that arena?
Well, most studies of employees, when they talk about employee satisfaction, most satisfaction correlates with the degree of autonomy. The more control you have of your life and your working conditions and your rostering, etc., the happier you are generally in your job. And it's the same for medicine. So our professional fulfillment will increase the more we can control our environment. And so managed care would be a major threat to our autonomy. Increasing patient expectations so that we're having to meet the hours that they want us to be available is going to reduce our professional fulfillment. So I think what we can do as a profession is that collegiality part. You know, it's interesting, we're at a college conference. College is about collegiality. And I'm not sure we take care of each other too well. I use the analogy we're a herd of lions really rather than a herd of cats. I think that doesn't just come in trying to manage us. I think often between two lions even, we aren't as soft and as caring towards each other as we could be.
Yeah. And I think I know I work in a general practice and we feel that pressure of patients' demand of I want this and I want that and I want the next thing and I want it now and Google told me I should have it. And but we also have to balance out the choose wisely stuff as well and trying to get the evidence across. Do you have any thoughts on how we do combat that ever-present pressure to give patients or people things that we don't think are a good idea?
Do I have any solutions? No, but I agree in that increasingly our evidence-based approach is seen as paternalistic by the consumer. I want this from you, doctor. I am paying X. Why don't you give it to me? And if I'm not giving it to you, you're not meeting my needs. So the obvious answer, therefore, is better shared decision-making, better health literacy from the patient's point of view, and more communication from the doctors. But of course, that takes time. And then as soon as you increase the time, you increase the pressure and you decrease professional fulfillment. There's an interesting, I believe it was MPS at a conference I was at recently, was teaching about patient communication. And they were talking about warfarin, for example. And they put a video together of a doctor badly educating a patient about warfarin before they put them on it. And then they put a good video of communicating. And it was just to show the differences between bad and good communication. And he just had a final quip at the end. He said, oh, by the way, our good video was 7 minutes, our bad video was 2 minutes and 50 seconds or something like that. It takes time.
It does take time, yeah. Very good. And so with your role with the Southern Cross Health Society, what do you see your role being able to do in I don't know, championing this, changing it, doing anything different?
Sure. Well, so Southern Cross, I've told this to lots of people, and I'm happy to go on camera for this as well. When Southern Cross first approached me, I wasn't interested at all. In fact, when I approached 50 of my colleagues, 49 of them said they were not that keen on Southern Cross, as I wasn't keen on Southern Cross in my negotiations with them as well. And I think what's happened is it's become like a divorce situation, really, between Southern Cross and the profession, because Southern Cross is a funder, and the profession has got some tensions with them on that. The reason I did come on board in the end is because what I didn't realize is they are not an insurance company. They're a not-for-profit bowling club that was started in 1961. For every dollar that people pay in premiums, we pay back 90 cents on claims. We kept the other 10% for overhead, which is better than a for-profit insurance company. So the sole purpose of Southern Cross is how best to take care of our 860,000 members, which is 1 in 5 New Zealanders, which is the whole range of, we have 110,000 members who are low socioeconomic. We only have 16% earning more than $100,000 a year. So we have 1 in 5 New Zealanders in our health society, and we're trying to figure out what's the best way to provide health to them. Gosh, isn't that exactly what the medical profession is trying to do? So I do believe that with improved trust, with improved communication, the two of us working together is the best outcome for New Zealand, and hence I did come on board, and that's my job. My job is to try and improve the communication and trust between the two again.
Yeah. And it's interesting because from our patient perspective, we've got the new payment system that's going through the GP practices for the Southern Cross members, and they just love it.
Yes.
Yeah. And so simplifying things, making it easier for them to get access, and doing it in ways that are novel and new and on trend, it's really helpful.
Yeah, well, we're trying to move from being what we call an insurance company to an assurance company. We're trying to be relevant in the patients' lives. But the problem we've got is that, and this is the entire private health insurance market in New Zealand, claims are going up 8% per year. So because we're not for profit, we have to put up our premiums 8% per year. You know, a 65-year-old male is currently paying in New Zealand over $700 a month, or over $8,000 a year for their insurance, and it goes up quite rapidly after the age of 65 as well. And if you're on an average salary, as our Southern Cross members are, of $48.50 an hour, if your premiums are going up 8% per year and your inflation is only going up 1.1, the entire private health insurance market in New Zealand is going to shrink unless we work together. And so what we're trying to talk about is maybe 4% per year is sustainable, and that means there's growth for the profession, there's growth for the patients, and there's growth for the future for sustainability for the insurance companies, is generally our messaging.
Very good. Well, I mean, I think we're living in exciting and nerve-wracking times, and I look forward to seeing what Southern Cross does and what you do with your role that you have there, and all the best.
Thank you. Thanks, Jan.